Hello, Nurse IJ again. Okay, let's be honest. Nurses, when you have a patient and you come back the next day and you assign that patient, we all like it because guess what? We're continuing care. We know the patient already and we are already established with the patient. We've already established a relationship with the patient. So caring for the patient will be much easier. But one of the things that I found out that nurses forget to do is check the code status. Because you had the patient on a Monday does not mean that on Tuesday they might have the same code status. So be very careful when you get a patient back. Make sure you check to see if the code status has changed. Now let me tell you a quick story that what happened to me. I had a patient on Monday. She was full code. I came back the next day, fully excited to care for this patient. Did not know that the code status changed. What is code status? Code status is when a patient decides to be full code, meaning if they go into cardiac arrest, then they will want to be resuscitated, meaning they want you to do everything to keep them alive. And then we have what we call DNR, which is do not resuscitate, meaning the patient has the ability to choose how to be treated if they are not doing well. Whether they go into cardiac arrest or they're not breathing or they have no pulse, they've decided to not resuscitate. That's what we call DNR. Now we also have what we call modified code, where the patient would choose, I want to be resuscitated, but she can choose not to go through chest compressions, or would want chest compression but not intubated. Some of them will say, I don't want chest compressions, I don't want to be intubated, just give me cardiac meds. That is what we call modified code. So whether your patient is full code, which is calling code blue when the patient is not doing very well, or DNR, do not resuscitate, when the patient is not able to function or they're losing their pulse, they're going to cardiac arrest. And then also we have what we call the modified code. So what is the story behind this? So when I had this patient on Monday, she was full code. And then on Tuesday, when I came back, she was DNR. But I didn't ask. I just knew, oh, she was my patient from last night. So I got a report from the nurse, got an update, and went about taking care of this patient. Guess what? This patient fell and went asystole in the monitor, meaning there was no heart rhythm. So we all run into the room. I called the code blue. By the time the code team came, they found out that the patient was DNR. They all looked at me like, are you kidding me? Why did you have to call the code when the patient was DNR? And it was so sad that I was the nurse. I didn't know the patient was DNR. So lesson learned. If you're getting the patient back, don't just ask for update. Make sure you check the code status of your patient. I hope this was helpful. Thank you for listening. And remember, subscribe, like, share, follow. Thank you, everyone. See you next time. Bye.